ET, again, this is very exciting times. I can't remember a time in recent memory where we've had this sort of excitement around new approaches in ET. A top class of agents that is now really kind of finding itself into the mainstream in the management of patients with ET would be pegylated interferon agents. Specifically, rho pegylated interferon has been investigated in a randomized setting in ET compared with anagrelide in individuals who have not responded to hydroxyurea, which is one of the standard ways of managing high-risk ET. And Ropeg far outperformed anagrelide in that setting. So I'm really excited to be able to have this sort of incorporated into ways in which we think about approaching ET that's perhaps a bit more challenging to treat. And then finally, I already alluded to the calreticulin monoclonal antibody approaches, bispecific therapy engaging approaches, and other immunotherapy agents targeted to mutant calreticulin. I can't wait to see how all of that pans out.